Do you really need a knee joint replacement? Have you been told by your doctor that you have arthritis in your knee and the only way to eliminate your pain is to have a knee joint replacement? Or maybe you've talked to your friends about your knee pain and they are emphatic that the only way to deal with knee pain is to have a knee joint replacement. And you're wondering, are there other options for me? Is there something else I can do? Well, then today's video is for you. We're going to discuss why the surgeon is recommending a knee joint replacement for you. Most likely, I don't know your specific case, but most likely, we're going to discuss what your options are instead of knee joint surgery, and then I'll give you some ideas on what you should be watching for and thinking about if you are considering or weighing the option of having knee joint surgery. All right, so why did your surgeon recommend surgery in the first place for your knee? Most likely you were having knee pain, so you went to the doctor who probably told you to rest and take some pain medication, maybe to decrease your exercise or activity for a while, and that didn't solve the problem. Then you may have been sent to physical therapy for a while to try to quote unquote strengthen the knee, which may or may not have been the problem, but probably the chances are really good that strengthening that knee increased your knee pain because it's causing more compression of a joint that's already a problem. So usually that increases the pain, which sends you to the surgeon. So you go to the surgeon, they take x-rays, they probably see arthritis in your knees. Here's a hot tip. Most of us have arthritis in our knees. We just don't have x-rays of it to prove it. Anyway, you probably have arthritis in your knees, and the surgeon says the only way to get rid of arthritis and get rid of your pain is to have knee joint surgery. Now, I will agree with the surgeon that you cannot get rid of arthritis without knee joint surgery. So if you are convinced that your pain is due to arthritis and you want to get rid of it, yes, knee surgery would be the option for you. However, if you are convinced that your pain is not necessarily associated with your arthritis, then I encourage you to listen on, because you may have had x-rays of both knees. And I've had this happen multiple times with patients where they had both knees x-rayed and the surgeon wants to do surgery on the knee that has less arthritis first. Now, why is that? Well, that's the knee that is usually most painful. So it makes sense that the surgeon wants to do surgery on the painful knee first. I don't have a problem with that idea, but let's consider the thought that that knee has less arthritis. So it can't be just the arthritis that's causing your knee pain, or else they would want to do the surgery on the knee that had the most arthritis, right? That's what makes sense to me. So I've had multiple patients come in and they were told that they needed to have surgery, let's say on their right knee, but it was their left knee that had more arthritis. And they're thinking, wait a second, if there's more arthritis in the left knee, it seems like that's the one that should have to have surgery. So if that's you and you're super confused about that, it would make sense that you would consider, hey, maybe it's not the arthritis that's causing all of this pain. So if it's not, what could it be? Well, there's a lot of factors that go into play, and we actually did another video that's the 5 common causes of knee pain. So we're going to drop a link here. I definitely recommend you go watch that because some of those may resonate with you as to what's going on with the knee pain. But there's a couple other things that could be causing a problem. One, your knee may not have full range of motion. So if you can't fully move that knee through its range of motion, then it gets stiff and cranky and tight and sore, which causes compression, which increases arthritis, which becomes a loop that you need help getting out of. You won't be able to do that on your own. You need to find a good manual physical therapist who can help you get that joint moving correctly to eliminate that compression and eliminate the future of the arthritis. Now, another thing that we're seeing really, really clearly in regards to arthritis is how your diet impacts how you feel. Now, it doesn't have any impact on if you're forming arthritis or not, but your diet can significantly increase your pain perception. Now, it's variable for different people, but sugar definitely increases pain perception. Some people, it's wheat and dairy as well. that can be a problem for some people. So if you're looking for some really simple ideas and you're convinced that you're going to avoid surgery, then I recommend cutting out sugar first. And I know it's hard because it's in everything, but you can do it, and I believe in you. And then if that's not enough of a pain reduction, try cutting out wheat and dairy and see if that decreases your pain perception, which increases your mobility and your ability to do the things you want. Now, there may be some people who have further food allergies. So you may be kind of outside of the normals, which are sugar, dairy, and wheat. And you may have some other problems. I have some patients who are allergic to nightshades, some peanuts. There's all kinds of different allergies out there. So if you feel like that resonates with you, I definitely encourage you to find either a naturopath or a nutritionist who can do some food allergy testing and really figure out what it is that's affecting your body. I had one patient who came in and she had, previous to seeing me, she had had a ton of joint pain in like her hips, her ankles, her knees, her shoulders, basically everywhere in her body. She did go through the food allergy testing and found out that it was nightshades that was a problem for her. She got rid of all of them and now she has very little joint pain. And now her joint pain is more related to actually functional activities as opposed to just living life, which is what it was before. So if you struggle with any kind of joint pain that's in multiple joints, definitely encourage you to look into the potential of food allergies. Now, the doctor has told you that you need to have a knee joint replacement to deal with the arthritis. And like I said at the beginning, I do agree with that you are not going to be able to get rid of knee arthritis that is already in your knee without a joint replacement. However, if you can get functional and doing the things you want to do pain-free without a knee joint replacement, wouldn't that be ideal? Because the thing is, every tissue in your body is designed to be able to heal itself as long as it's moving correctly. But I had somebody point this out to me last week, so I'm going to point it out to you. That's only if it's the original manufacturer's warranty. So it's only if it's the body you're born with. As soon as you have surgery, you're changing things and you're changing the dynamics in your body. It's never going to get back to 100%, no matter how hard you rehab, no matter what you do. Things change when you have surgery. So it's really important to try to stay in that original manufacturer's warranty so that you have all the healing capacity that's available in your body. Now it's over to you. What questions do you have regarding your potential knee surgery, or if you should or shouldn't? I encourage you to drop a comment below. Love to answer your questions. If we need to, we will make another video to try to help explain this. This is a complicated decision, and I understand that you don't take it lightly. So I want to provide you with as much information as possible so that you're able to make the best decision for you and your health. Now, I definitely encourage you to go check out that video on the 5 common causes of knee pain and see if any of those resonate with you. Have a great day, everyone.